Verbal versus nonverbal communication. When they do not agree, which one speaks louder? You tell me. I'm really glad to be here today with this great group, and I'm just really looking forward to, having this class and going through. I'm sure you're just gonna do a great job. Okay. What did you believe? What did you get out of what I just said? Did you hear that I was looking forward to your class and for you to be med aides and that I believed you were going to do great? Or did you believe the opposite? My words were saying that it was great, right? But what was my nonverbal, my body language? What was it communicating to you? Quite a different story, right? So when nonverbal and verbal do not agree, wins every time. You've probably had this experience at some point with maybe a significant other, family member, close friend, when they say, I didn't say that. And you say, well, maybe your words didn't, but your body language sure did, right? So we have to be very careful as med aides with our nonverbal. Sometimes, like they say, it's not what you say, it's how you say it. And this certainly applies for med aid. Now, having said that, let's talk a little bit about dementia and Alzheimer. Remember, Alzheimer is a type of dementia. Dementia is an umbrella term, and there's several different types of dementia under that, in which Alzheimer is probably the most prevalent. Our cardinal rule when talking about communicating with folks with dementia is never argue. Never argue. It does no good to argue with someone who has dementia. When you do that, all you're doing is stirring them up, having them get more and more frustrated. What they are saying is true, and you're telling them differently isn't going to change that. You are living in their world. One of the most important things we have to do is validate, and not just for folks with dementia, but for everyone we're communicating with. Everyone wants to be validated. So if George comes to you and's mad about something, he's mad because he says he hasn't eaten in 2 days. Clearly you know this is not the truth. But does that really matter? No, if he has dementia, that doesn't matter. You need to validate his feelings. So you say, oh my gosh, that must be awful. That's validating. Then say, I tell you what, George, let's go into the dining room. I bet I can get you a little something. It doesn't matter if he just ate. It makes no difference. If he has a piece of toast and a cup of coffee, that makes no difference. So that's how we handle those kind of things. And when you're passing meds as a med aide, this is extremely important. I have seen so many times when med aides are in a hurry, they had to stop passing meds to go help a CNA or help a nurse, and they're running around. Now they're behind. Everything on their MAR is about to turn red, which means it's late. And so here they got the pills ready, and they're going in Gladys's room, and they walk in, here's your pills, Gladys. Now, Gladys has dementia, and folks with dementia, the actual words you're saying don't register completely or very quickly. So she may not hear what you're saying, but she can read your body language, and she feels your tension and your rush. And when you walk in with that med cup leading, here you go, Gladys, here's your meds, you're going to get this. Whoa. She's going to shut down. Boom. It's going to take time passing meds to folks with dementia. One way or another, better to, before you open that door to go into the room, Take a deep breath, let it out, walk in the room. Hey Gladys, how you doing this morning, huh? Yeah. Maybe open the blinds a little, sit down next to her, and then say, oh, I got your pills, here we go. You're going to have much more success that way than walking in all locked and loaded, okay? It really will make a big difference, and I encourage you to try this and really make it part of your routine. Now, I want to talk to you a little bit about being a med aide and why I feel like having a good med aide is so important. So, when I think of a med aide, now, you know I can't draw. That is not a cloud. I'm drawing a hamburger in case you can't tell. Okay? All right, so this is the nurse. Now, the nurse, she knows the medications and the diagnoses and the physician for Jack. But does she really know Jack? Yes, she can pick him out of a lineup and she knows his diagnoses and his meds and his physician and the family. But she doesn't really know Jack. Not like the CNA. Now, the CNA, she knows Jack, right? She knows how that he wakes up slowly, but once he's awake, you got to get him to the bathroom right away, and then he'll be continent. When you get him to the dining room, don't bring him his food first. He likes his coffee first with 2 sugars, right? That CNA, she knows all these little idiosyncrasies about Jack. But does she know the diagnoses? No. Does she know the medications? Certainly not. Now, who is the only person that will know the diagnosis and is on the floor and sees Jack every day, all the time, and knows Jack? That's you. That's the med aide. You're the beef in the middle. Now, why that is so important is because you're the one that's going to know when things are going south. Remember when I told you about that therapeutic dose range, the range where it's safe and effective. Over it, it's toxic. Underneath, it doesn't work. And in the elderly or people who have other disease processes or have compromised livers or kidneys, you're going to see that therapeutic dose range get much more narrow. It's harder to find that sweet spot. And they're going to have signs and symptoms of toxicity much faster. Okay? And you're the only one that's going to know that. As a med aide, you're on the floor enough to see those things. The nurse, by the time the nurse notices that there's signs and symptoms of something going wrong, it could be days. The CNA may see some signs and say, well, something's wrong, but not know what it is, not be able to put 2 and 2 together. It really takes the med aide to do that. And that's why you're so important. And you need to communicate both to the nurse and to the CNA. Let me give you an example. Anytime, especially an elderly person, starts on an antihypertensive, something to bring the blood pressure down, that sweet spot, that therapeutic dose range can be very narrow. And just adjusting that dose a little bit, you can see big results. So if somebody is on a new, say, beta blocker, an antihypertensive drug, that really can cause some orthostatic or postural hypotension, like they stand up and they see the whirlybirds and about to pass out, or could pass out, that is significant. So as a med aide, anytime you see a change in medication, especially in something like that, an antihypertensive, and really in many meds, can you imagine how helpful that would be if you told the CNAs, hey, Jack's on a new medication today. Be careful when you get him up. He might be dizzy. Wouldn't you like that? Wouldn't you appreciate if someone would do that to you? Otherwise, you're going to go in his room and assume everything is normal. And you're going to get him up like regular. But this time, he might get very dizzy and pass out on you. And to have a heads up about that is a powerful thing. It's a great tool. You do make a difference. Also, be careful in your communicating each way. Double agents get caught. By that I mean, I have seen where the CMA will kind of side with the nurse, or the CMA will side with the CNAs, or both. Be careful not to get into that mess. Here's an example of what I'm talking about. Maybe it's morning and the nurse has a doctor coming. She's trying to do assessments. Nobody's up and ready, and she's trying to get these done, and she's frustrated, and she says to you, why isn't anybody up and ready and going? Doctor's going to be here soon. Everybody's running behind. What? Is everybody lazy or what? And you could go, yeah, they're lazy. Now, that may not be the truth at all. It might be, but it might not be. Lots of times there's situations going on, you know that. Rather than side and say, yeah, they're a mess, or take it the other way and say, really, you think their job's that easy? Neither one. Just bring up facts. Say, well, I don't know if you know, but Harold had quite a morning, and I know 2 of them were in there for about an hour cleaning up and getting things set for him, because it was not pretty. So I can see why they're running behind. That's all you need to do. That's a professional way to handle that. On the other side, the CNA sometimes will be having a rough day and they're running and they're like, would be nice if that nurse could get up and help us. She's so lazy. What are you going to do? Yeah, she's lazy. Or are you going to be like, are you kidding me? Instead, just say, you know, I used to think that too, but boy, after I saw the load of paperwork they have, she's almost chained to that computer. But let me help you just for a second. Handling things in a professional manner, not taking sides, being careful of that kind of thing, will make you a true professional and definitely respected.